Hey everybody, this is Dr. Ben Pearl with FitFootU. Today we're going to be talking about pain management and natural ways to heal. So, if you've ever seen the movie Dope Sick with Michael Keaton, brutal what sometimes pharma can do. That was a gross misrepresentation of a drug that was put out as a non-addictive drug. There's so many new natural ways to heal using energy, using stretching, using facilitation with muscles. This is one we're going to talk about today. It's electromagnetic therapy. I happen to have a pain management doctor. He's an osteopath who is a patient of mine. We're going to come in and evaluate how he's done. He's had several treatments. He's had metatarsalgia, which is actually on the bottom of the foot. You get inflammation on the metatarsals. He's on his feet with his job, and we're going to get, in his words, what kind of improvement he's had. So let's go into the treatment room. He's currently having one of several treatments. Keep it moving. Okay. So I'm just going to ask some generals. First of all, what changed your philosophy with pain management to looking at methodologies like this? What was the light bulb in your head that switched?
In my field of pain management, there is a lot of utilization of narcotics and a lot of other medications to complement the use of narcotics. And I didn't see people that were improving. And since I took a fellowship in integrative medicine, I learned about other alternative modalities to heal. And as I've grown to use those kind of modalities for my patients, I've been able to see a much better difference and more improvement. And I look at from a holistic perspective, the patient is getting improvement. And that's what's important to me, not just looking at the symptoms, really about getting to the root cause.
What are some of the integrative pathways besides what we're doing now, electromagnetic, that you put in your funnel as treatment options? What would be a couple?
For me, the type of people that I see who are really inflamed, it's understanding the inflammatory response and where it's coming from. And the first thing that I look at is what are they eating and what's their diet. And most of our diet is full of inflammatory substances and proteins and just a lot of junk that's not needed in our system and highly inflammatory. So switching over to a organic-based diet without any processed foods has a lot of merit in reducing overall inflammation. And then you can do other things like eliminating chemicals in their bodies. We're always around chemicals such as glyphosate, and that's prevalent in all of in the grass and the foods that we eat and just our overall environment. So mitigating exposure to that is really helpful. And also just other toxic chemicals that we're around all day, like your personal care products. Those are harmful, over periods of time. So switching to less harsh chemicals, more organic and natural-based chemicals as personal care products is a better choice.
How do you feel about things, quote, chelating agents and things like antioxidation as part of the road to better mojo in your body?
Yeah, I'm all about antioxidants. I think whether you get them from natural supplementation or whether you get them from foods or other supplements.
Alpha-lipoic acid is a big one. I know there's been some Mayo Clinic studies on that with diabetic neuropathy.
Yeah, then you can do your other anti-inflammatories. Boswellia is another one that can be used as a
turmeric. Is at least for inflammation standpoint.
So these are really good things. And then molecular hydrogen is really good for anti-inflammatory. And then you can also use things like hyperbaric oxygen as a means of reducing inflammation and swelling in the tissues.
They talk about nitric oxide as a big component in the wheelhouse with what you're doing with hyperbaric and this therapy.
Right.
Overall, what have been your thoughts on results with this? Meeting expectations, what it's done, what it hasn't done.
Yeah, it took a while to dial in what was needed for me. For me specifically, it was 2 repeated treatments back to back that really made a huge difference in the metatarsal pain that I was having. I was using, I wasn't using a whole lot of other modalities other than ice and massage to reduce the swelling, and also improve my footwear. So that was helping to a degree, but this really took it to a level where I haven't had the pain return back to that level since those back-to-back treatments.
If you had to give a raw score number in terms of percentage relief where you are from beginning, I guess one is pain relief, I guess the other would be function.
Yeah.
How would you rate those
Yeah,
improvements?
I'm at about 85% improvement since this all started about a few months ago on the right side. And this all started back, I would say, September or even August earlier this year, so it's like almost 4 months now. And so it's been really, now I can pretty much almost go back to normal activities on that side and not have to worry about it getting to the point where it was.
Okay. All right. Well, thanks, Doc, for participating. I appreciate it. It helps our patients. We both have patients, and I think the more that we can educate the lay people on options and not just see the the ads on TV, which are largely pharma-driven, unfortunately, the more people will know that there's other options out there. Till next time, this is Dr. Ben Pearl with FitFoot U.